Call the meeting to order. Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Mr. Jack W. Balch,
Present.
Mr. Kevin Hom,
Present.
Mr. Al Wazo,
Here.
Mr. Craig Steckler.
Present.
Motion to approve the minutes or any corrections to the minutes?
I'm going to abstain because I wasn't here.
Oh, I'll make a motion.
Second.
All those in favor?
Aye.
Opposed? Carries.
If I could make one comment pertaining to the minutes. One of the last things that was stated in the minutes was a discussion about the contingency in the project, and that we had a kind of a finite or smaller contingency as we were bidding the job out and using it. And I think Jack had mentioned that, that was something that we should look at. So we have had a meeting with that happened between myself, Nancy Farber, Mike Wallace, and Mr. Balch in the past, since the last meeting, where we just basically discussed that. And the decision was that when we do our new budgets for the coming year for the hospital, which is completed in the June timeframe, that we would consider the overall budget, and at that time potentially would be looking at increasing the contingency amounts. But we kind of wanted to see what happens for, with the project, then give it a little bit more time and then make decisions around that. So I just wanted to follow up because that was brought up last time, that, it was considered, and we have had discussions about it, and there is an action plan about that.
Do we want to make that a discussion item now, or just leave it tabled until we get the next budget?
Well, I would say if there's any points or any discussion that you want to have now or things, I think it's fine to talk about it now if anybody has any comment or thought.
Does anybody have any comments?
Well, the only question I had was, it looked like a good portion of the contingency was taken up in the latest financials that we saw here.
Yes.
And so I don't know if the time for that discussion is at this moment or when we get to the financials.
Well, we can discuss it when we get to the financials, but it is basically what's happened is that we had the budget, and then we bid the project out to the subcontractors out over time, and so we've used the contingency as the bids have come in, and if they've come in and they have in several areas come in over what we had budgeted, and so we use the contingency to finish the contract. So I think the percentage is 92% of the project is now under contract.
Okay.
And the only things that aren't are the things that are happening at the end of the job that we still had some things we wanted to tweak, such as the driveways in front of the emergency room, the sort of connecting plaza between the existing building and the old buildings, and those things are still kind of being designed. And so we thought if we bid it out as they stand and then we have to come back with a bunch of change orders, we'd be better served to finish the different redesigns or additional designs and then go out to bid on those. So that's what's happened so far. As the bids have come in higher, the fact of the matter is we've been in a period where there's a lot of construction going on in the Bay Area. There has been inflation, and we were told by our general contractor just within the last month that we were fortunate to bid this job when we did, that the costs have gone up about 30% since those bids were completed. So I think that while we have bitten into the contingency to a extent, significant amount, we're under contract with the largest, most important parts of the project.
So the discussion was whether to go ahead and fund the contingency
No.
as it was expected, or just to continue using it?
to consider increasing the contingency
Yeah.
to a reasonable level. And that will be something that we will do when the next budget is prepared
Okay.
and getting a,
And that makes sense.
but, my opinion is, as an oversight committee, if it's unsure that the facility can be completed for the budget as presented, we ought to be establishing a realistic budget going forward and not have our head in the sand that there's not going to be anything, some reasonable amount
Yeah.
was the question I brought up before.
I
What
think
that
that-
reasonable amount is, we'll come back to it at a later date.
That sounds logical.
Yeah, yeah.
Okay. I don't assume we have any oral or written communication at this time?
There are no oral or written communications.
Okay. Mr. Fagan?
So committee membership, I don't really have much to report. We have one more member that we are in search of, and the board has looked at and nominated a couple of people, and we have not had somebody accept. So hopefully by the next time we meet, we will have our 5th member on the board.
I shouldn't have taken a bite at that time. Bob, would you like to give your report?
As we went through our job walk a little earlier this evening, that schedule basically shows the forecast of how we plan on finishing the project. The one item that does extend beyond early April will be the BART building itself, which Ed pointed out that we have poured the foundation, the footings, and we will be starting the block work tomorrow for the exterior shell of the building. We do anticipate finishing the job in May without any further delays with the weather. We don't anticipate it once we get that building enclosed, such as we have the garage. We anticipate, as I said, meeting with the city on the 27th to see for a temporary occupancy permit what they will allow us to do. We anticipate that we may be able to move in a little bit closer to our original March date rather than the April 1st date. But we will, nevertheless, we will be close and be using the garage in April for its intended use. The first part of the garage will be for the employees, first 3 floors, and then once the upper floors are allowed to be used, they'll be for the construction workers. That's always been the plan. Then the helipad will probably come into use. The providers of the helicopters want to have a break-in period of about a month before they actually use the helipad itself. So once that's commissioned and able to use, there'll be about a month of different companies flying in and out, getting used to the new location and stuff. And that's all part of the plan.
If it's a helicopter, I don't think we should use the word break.
Yeah, you're probably right, Jack. Yeah, yeah.
Okay.
Is there any questions for the garage?
I think the one point is that we're not right on our schedule. We were going to be substantially complete in March and final completion at the end of March, and we're running a little bit over that. Some due to weather and some due to just some delays that happened over the holidays. So
It
that's where
doesn't
we're.
appear that we're really that far off the schedule, though. It's very minor compared to the overall time of the job.
That's correct. Yeah.
And it's not affecting the operations in any way?
No.
Adversely?
No. The interesting thing is they had said they would be completed with the pours of the floors by Christmas Eve, and they were. So up to that time, we were chugging along, and then You might remember around the 18th of December is when it started to rain, and we had about a week of rain, and then that was followed. So some things like getting the BART foundations ready and stuff like that, that was the BART police foundations, that all was kind of delayed with the rains, so.
Question. What are the security measures that you're going to be using to protect the employees that go in at night, come out of the building to work and back to the parking structure? Do you have cameras or?
That's a very good question.
Yeah, there is a security system and all going in there with a lot of cameras, Craig. And then I'm sure on the off hours, as it is now, there's a 24-hour guard service, 724s, and those are canine also. I'm not sure what their final plans are for security that they're going to employ once the garage comes into use by their employees, but I'm sure there'll be some sort of escort.
Yeah, currently we have our security guards will escort employees to and from the parking lots, and I think that's going to continue with the new garage.
Yeah. We have one of the things that you're gonna see, or we're gonna talk about in a minute, is in the finances, is we had budgeted about 75 grand for security systems in the garage, and we've gone through multiple layouts and then bid it out with multiple vendors, and it's turning out that we're gonna end up spending something more in the order of 300 grand for security, with cameras on each floor, having those all covered, with 3 panic buttons on each floor. And it'll be tied to our existing we have a base station that's manned at all time to watch the cameras and things like that. That's going to be greatly expanded. And the other thing that we spent a lot of time in the design is the back part of the garage obviously backs up to BART and the sidewalk, and so that will have a fence line that will run with barbed wire on it up to about the last quarter end of the garage. And then we have in the plans that there are, it's sort of a design element, but it's meant to keep anybody from trying to climb up the side of the garage. And so there are these sort of spiked arms that come out along the side of the garage where the barbed wire fence stops until you get over to the BART police station. So we've tried to anticipate, people, any kind of problems with people that might try to get into the garage from the BART area. We were surprised at the last construction project, the number of people that we had the K-9 unit stop from climbing over the fence and getting into the parking lot area. So it's a very, we never having worried about it when it was just a parking lot back there before, we thought it was all pretty safe because it was all fenced off. But we were regularly getting people over the fence. So it was then our concern to make sure that that garage is safe in terms of people getting into it from the other side. And then, as mentioned, we have the 24-hour security. We will have people on the grounds. And then in the evening shift, first of all, in the construction, while we have construction, we have a K-9 unit. But what happened is we used that at the last project and then decided to keep it in between the projects. And the plan is to continue to do that, that we have basically for 12 hours at night, we have a K-9 unit that's out there to patrol the grounds and then to do escorts. So that's been the plan. So that's actually one of our cost overruns, is the upgraded security for the garage.
I'm assuming Gus Arroyo's part of the.
Absolutely, he is.
Okay.
And that's one of the reasons that we've upped the security game and plan over there, because of his involvement. Okay.
As we discussed, going around the Phase 2 project, that's what we refer to, it's actually the Morris Hyman Critical Care Pavilion. We're within 8 days of being on schedule. 5 of those are because of rain. We anticipate eventually catching that schedule and we're trending in that direction. And we will probably be, by this time next year, very close to being, that whole structure being dried in, which means the whole facade on the building and the roof in place. And so it's gonna, each one of your visits, you'll see a dramatic difference as that building continues to go up and we start putting facade on that building. So we're very excited about it, and we've not had any monetary surprises. So we feel very confident that the goal for that building is the same as we did for the central plant.
Any questions on that? Okay. Cash flow.
So you can see that we have, for the garage, generally speaking, followed the plan in terms of what we thought our cash flow would be. It's actually been a little bit lighter than what we anticipated at this time. So as Ray will report shortly, it's running a little bit behind. It's probably best demonstrated in the next graph, where you can see that our time schedule is a little bit ahead of our spend schedule. But as mentioned, you know, the concrete work and such went on as per schedule. So the project's doing fine. We haven't paid out quite as much money as we anticipated at this time. On the Hyman Pavilion, you can see 1 month where the costs were higher than anticipated, and what this was an $8 million pay application for all the steel. So the steel was manufactured in Utah, and this bill came forward when they completed it all. And so it was, we paid for that, and then it just got transported over to site. So that's the outlier, or why that expenditure went out, or went as large as that. I would think that, you know, you can see that for the month of November, it was dramatically less, and the same things happened for the pay apps that have been paid for December and January. So we're back pretty close to in line. You can see on the following page, probably best that steel payment kind of pushed us over what our spend plan was, or our expected cumulative amount, and we expect that to come back in line, but certainly by the time we meet again. But I would say by February, March timeframe.
Any questions? Mr. Graves.
Okay, just looking at the dashboard here, I'm going to highlight a few things on this report for the garage. Looking over to the right side, the cost, we're showing it, we've earned 63% of the contract this is through November. And again, on my slides, such as these, I'm reporting on the main construction contractor. I'm not reporting on some incidental construction work. This is just the main Vance Brown contract. And so you'll see that we have an approved change order for the 962. That's for the BART garage, so that brings the current up to the 19.2, and they've earned 12.2.
Not the BART garage, the BART police station is what you meant to say.
Yeah, I'm sorry. I meant the police. Yeah, the police station at the garage, and so they've earned 63% of that new contract amount, and that one contract amounts to the 5.3% you see down at the lower right, and one change order. Over on the schedule side, through November, we were at 70% time elapsed. So we do have a gap there of about 13% between the earnings and the elapsed time. Just by comparison, the pay up for December for this job just came through, and In December, they earned 1.3. So they're running at about the same, but the gap between the two measures narrowed by about 1%. So they are beginning to bring the two into line as they get towards the end here. We are projecting, as Ed was saying, we're projecting being behind at this point about 20 days on the garage and about 26 days on the BART building. And as Bob was pointing out, the important thing for us is really getting use of that garage, because we need it to park not only employees but the construction workers, which are starting to increase now. And so main thing is when we can get those lower 3 floors so that we can use those, that'll take care of a lot of the parking that's being done away from the site now. So that's the overview of the garage. Any questions on that? Anyone?
How many of those delays are because of rain?
I was going to give a status on the rain for both the garage, for the pavilion, but of course today's rain will be the same on both. This is the report I'm reading from the main pavilion now, so not the garage. The normal rain through November, and usually we have rain starting about May and it goes through November, is 10 inches. Excuse me, 10 rain days. A rain day is 1/10 of an inch or more, that by the weather records. And we actually had through November 9 days compared to the 10 normal. In the case of the Hyman Pavilion, which we'll be talking about in a minute, the contractor only requested one of those rain days through November. And then the December numbers, you actually normally have 9 rain days in December, so that brings us to 19 for the year. And we actually had 9 days, so that brought us to 18 days for the year, very close to the 19. And again, the contractor on the pavilion only requested 1 rain day. Many times the rain happens at night, and 1/10 of an inch, and by morning there's not enough out there to worry about, so they don't request the day.
Yeah, and I understand on the provision. I mean, we talked about the rain behind on the pavilion, but we were told it was more on the garage. So what has the contractor been awarded on rain delays for only the garage?
I don't believe they've been awarded anything. I don't think they really used that. I don't think they plugged that into their schedule.
Okay.
And so it's the contractor on the pavilion is being much more careful to claim, but they're claiming very few days.
Okay.
So.
The only other thing I'd want to clarify on this report is you see the change order amount for $962,711. So what that is unlike many change orders where you get into a project and you find things that need to be fixed or whatever. We started this job and bid it for the $18 million, and then put an allowance aside because we had not completed the design of the BART police building. So we put the allowance aside that was a little bit more than the $962,000. The design got completed. We put that part out the bid. The bid came in within what we expected. So it's coming in as a change order, but it was in the original budget
So
for
it
the
didn't hit
project.
contingencies.
Yeah, yeah.
Okay, great.
Okay. Unless there's any more questions on the garage, we can move on to the pavilion and cover that. The Hyman Pavilion, the GMP now, this is the R&S contract again, is the 237, and we've had no changes on that. They've earned 37 million, which is a 16% earnings. And again, at the bottom right, there's really no change orders. On the left side, the percent elapsed time through November was 21 days, so there was only a 5% spread. Since your earnings curve, is typically an S-curve and your elapsed time is a linear relationship, generally at about 25%, you would show 20% earnings. That's the 5% spread between the two lines. So I'm not too concerned about the difference in the 16% and the 21%. That's about normal when you consider the S-curve earnings shape. The contractor, by their schedule, is showing being about 8 days behind, which, given the fact that they're working overtime to try to, keep the job on schedule, we're not too concerned about their ability to get it back on the 8 days back. So again, substantial completion is projected out mid-18, but we're hopeful that if they go per their schedule, we'll be getting the project finished possibly ahead of that and not have to use the time contingencies that are about 60 days in the job. So overall, the work on the pavilion is proceeding very well, and the contractor's performing well, and working. The whole team has been working very well together.
Any questions of Ray on any of the reports? Thank you very much. Chris.
Okay, we'll start by taking a look at the expenditures for the parking garage for the period ended November 30th. About a little over $6.7 million of expenditures in that period. Of course, the lion's share going to construction. Included in that number for construction is about $22,000 for materials inspection of concrete and footings. We've got some money in there for PG&E, and of course the balance of that going to Vance Brown, the general contractor. Also of note, about $46,000 in permits and inspection costs. About $12,000 of that went to the city of Fremont. And again, about $45,000 going to materials testing and inspection on that job as it moves forward. Other than that, we've got about $36,300 in leases, and that's parking leases. As you're all aware, we displaced a lot of hospital parking to build both these projects, and during the projects, until we get the garage open, we're leasing additional space around the hospital area. So that's that cost for the period. About $75,000 going to construction management, and about $51,000 towards architectural and design fees. So again, about $6.7 million in the period. Total expenditures on the garage as of November 30th, a little bit under $12 million. So are there any questions on the spending in the period?
With your A&E cost and this $51,000, what do you expect total? Do you expect to meet budget on this?
Yeah, that in fact, why don't we move to the next slide there, Ed?
Yeah.
So yeah, we expect to meet budget on A&E. Based on that, just under $12 million in expenditures. Our estimate at completion is running pretty close to budget. We're eating into about a little under $250,000 of the contingency on that job. As Ed mentioned, a big part of that had to do with the upgrades on the security system that resulted after the analysis of what was going on in there. So this job in pretty good shape. Expect to come in at budget or under at this point, barring any surprises. But you never know when a surprise can pop up. So right now it's looking pretty good.
Okay.
So with that, we can take a look at what's going on with the Morris Hyman Critical Care Pavilion. Spending in this period, a little under $22.2 million. Had about a little over $1 million in architectural and design fees. That included some work on the piers and inspection and testing on that. We had some estimates going on related to value engineering in there, as well as some stuff for commissioning services and consulting, some consulting on value engineering on waterproofing. But the balance of that largely going to Ratcliffe as they do their work during the construction. Little over $655,000 in construction management for the period. Testing and inspection came in at $407,000. That includes City of Fremont. We had some permits from them, about $2,600. Oshpod for the period ended up at about little over $60,000. That included application fees totaling $8,750 for some of the value engineering changes that were submitted, and then a larger change order that Oshpod wanted $51,600 to review. It was a pretty large change, and they felt they needed to charge extra. Also had some surveyor costs, about $4,300. We had construction testing and inspecting of materials totaling $237,000, a little over that, as that job really took off. And then inspection of record costs, just under $103,000. Construction costs, about $20 million. Of course, the lion's share of that going to Rudolph and Sletton. We did have about $343,000 of insurance costs for workers' comp and general liability hitting in the period. We had some communications costs of about $6,900. The balance of that going to Rudolph and Sletton. Is there any questions on the expenditures on the pavilion? Okay, quick look at the crystal ball. Look at what's going to happen. Still early in the job. Ed, we need to advance that. There you go. Still, at this point, as you know, we've had the discussion about contingencies. At this point, we're not projecting anything to take us over what the current contingency is, but you know, as Jack mentioned, we'll be taking a look at that in the next budget cycle. At that point, we'll be further along in the bidding process and have a better idea where we're going to be. So,
I do have a question on this one.
Yeah.
And that is only on your A&E fees on this?
Yeah.
Because you've got $7 million to complete and a couple of years to do it, and you just spent $1 million last month?
Yeah.
Where does this $7 million budget come? Is that what we have in the budget, or where did that number come from?
Those numbers are in the budget right now, yeah. And actually, Ray, you want to talk about how that $7 million estimate to complete was developed?
We basically take the numbers of the, the estimated cost that we've already spent, but then we're also looking at the work that's under contract, and we try to estimate if we foresee any of the work that's under contract. Let's take the Radcliffe's contract. We try to project out anything that we can foresee that the additional fees that they would have, and so that gives us a projection out on completion. So that's basically what we're trying to do, is basically start from where we are today, expenditures, where we are contractually with them, and project any contract changes to completion.
But we've established this number ourselves. It didn't come from...
No, it didn't come from the architect.
Okay. Thanks.
Yeah.
By the way, when we say architect, this includes all of the consultant fees.
Yeah.
Right.
Just the architect.
Yeah.
Does it include testing and inspections in this number?
No, testing and inspections in that permit and inspection number, yeah.
Okay.
Yeah.
Thank you.
Sure.
So I had a question, just on the safety record of the construction so far, is there anything that might be at risk in terms of workers' comp or?
Actually, that's a good question, because we have, this project was of such a size that we ended up doing an OSIP, an owner-controlled insurance product. So the hospital has set up a insurance program that covers everything, including the general contractor. And so the safety record is critical to that, because anything that happens on a workers' comp or injury, it's going to be paid out by the hospital's insurance program. And so far, your safety record is perfect.
It's good to hear.
Yeah. So that's something that's tracked, and they have signs up on the work site. And
Yeah, I
it's-
noticed
it's-
that. That's why I
it's-
asked about it.
Yeah, it's important for both sides. And as a matter of fact, they have some skin in the game too, that if their safety record is good, there's an incentive for them in the program as well.
So the hospital is basically the insurer of the...
Self-insured.
Yeah.
It's self-insured?
Yeah.
Yeah, well, I wouldn't say self-insured as much as we are the ones that bought all the insurance for the project. In other words, there's a baseline of general liability that the contractor has to keep, but we insure on top of that, and earthquake insurance, workers' comp insurance. We have purchased all that for the whole project.
So how does that get accounted for in here?
It's included in the construction costs. Yes. So it hits, every time we pay a insurance premium, it's showing up under construction costs. Because
It's on behalf of the contractor, basically?
yes, if we didn't do it, it would be in the contractor's bill to us as part of their insurance costs would be passed along to
With a
us.
significant overhead, I'm sure.
I want to give a quick update on
No,
that.
that.
Bob Ford is our consultant on this, and he's the one who proposed this approach and has helped set it up and organize it. It's actually being run by another party, but he called me this morning and we talked, and he said, everything is going quite well with the OSIP. The things they're setting up, working with the trade contractors to keep a safety program has been working very well, and they've had very few, if any, problems with workers' comp things. So he's very pleased with the way it's going. We're 25% through with the job, and he said it's under budget and looking good.
Yeah, so this is something new, right? I mean, we didn't do this for the...
The other project
power
with
plant
Swinnerton,
Correct.
we did a CSIP, a contractor-controlled insurance program. That being the general contractor set up a program that would cover a lot of the subcontractors. And the idea is instead of having each one of the smaller subcontractors go out into the market, you could buy it at a better price under a volume contract. So that one was done under the general contractor. In this case, we're taking the lead on the setting up that program. So the savings or benefits would accrue directly back to the hospital, not.
Basically, it was recommended by our insurance consultant that if the project gets to a certain size, significant, big size, these $200+ million, that it was to the hospital's benefit and would probably, if you maintain a decent safety record, it would save us money. If the last projects were more in the $100 million, and his feeling was $100 million and lower, it was better for the contractor to take all that liability. They could get a better deal.
That was probably the threshold.
Yeah.
What were the, just curiosity, what were the anticipated savings?
Again, it all is contingent on how you do in the safety.
Sure.
But if you do keep a normal safety record, which was like I think it was like at a 30% of what was set aside in terms of premium, it was savings of about $2 million.
Got it.
But you don't have first starter coverage in any of these. There's a deductible, I'm sure, in all the policies.
Yeah, there are
That is-
deductibles.
That are underwritten by the hospital.
Yes,
That's,
absolutely.
Thank you.
Yeah.
Okay.
Good question.
Quick look at the funding. The big story here is really that we went out to the market with the remaining $145,500,000 in approved bonds. Went out to the market just before Thanksgiving. Did pretty well. Many of the tranches were well oversubscribed. So we had good response on the offering and ended up with an interest rate, I'm going to claim it, it's under 4% at 3.99. So pretty good, particularly given that we went out the week after the Fed meeting where the Fed had discussed raising interest rates. So we felt really good about the performance of that offering that week.
What's the term on these bonds?
There are variable tranches going up to 30 years. So the short terms and the long terms were the ones that really were oversubscribed. The middle tranches were fully subscribed, but not as oversubscribed as the other two tranches, which was interesting. They were going long and short and mid-range, a little more cautious.
Chris, are these considered tax exempt? Or
Yes,
not?
these are tax exempt bonds. Yes.
Of course.
Yeah.
Nice.
Yeah. Yeah. So all the funding from the general obligation approvals is in place. At the end of November, we had just under 300 million, about 248,000 of qualified expenditures. 248 million in qualified expenditures to pull on that. We also have about $9.3 million in funds from other sources to go towards this. So still looking at about $10 million hospital contribution. Hospital is in excellent shape to do that, and not an issue at all. Our operations are doing really well, and I don't even anticipate much of a blip in our days cash on hand when this is all over. So we're in very good shape to finish this project.
Foundation also.
Yeah. Yep, you bet. Yep, the foundation's a big role in that. Yep.
Okay, any other questions?
Let's see, our last item is the meeting schedule. And our next scheduled meeting is April 20th, 2016. Another Wednesday meeting,
April 20th?
April 20th. Sound okay? We'll do our usual notification ahead of time. You'll be on this continent this.
I'll be in Cancun until the 18th. That's
Well, perfect timing
I'll
then.
be back.
Okay.
Okay, with that, meeting adjourned.